Hi, I'm Ash Damle, and I'm the CEO of MEDgle, and I'm here to do a screencast, which will be an overview of our clinical GPS application. So I'm just going to go ahead and log in. So here we see there are four major sections. The first being our clinical GPS, which we'll jump into a little in a minute. Second, we have lookup, which allows you to quickly look up information about diagnoses, procedures, medications, how they relate, and what to do. Third is our search and analytics section, which is there to go ahead and allow us to go ahead and search and slice and dice all the interviews that we've conducted, and this is really for the enterprise version. And lastly, our My Account, which allows me to go ahead and administer this account. So let's go ahead and jump into clinical GPS. So we have four major columns initially, which is first the patient information, which is entirely optional and used to go ahead and connect with an EHR or a practice management system. Second, we have signs and symptoms, which is our initial set of inputs. Third is our suggested set of questions which are presented to the user after analysis of the inputted information. Fourth is our current results. So let's go and kick off our new interview. So here, once again, we can see our optional information. We can go ahead and see that we can present symptoms, information about duration, age, genders, presenting diagnoses if we know it, vital signs, lifestyles, and a variety of other information. So let's go ahead and just look at an example, say chest pain for 2 days for a male who's 23 years old. So what we can see here is 3 columns are now filled in. Second one giving our suggested questions, which is one is how severe is it, the potential sub-symptoms it may present from chest pain. Third is our emergency symptom questions, and lastly is our lifestyle modifiers. And these are all based upon the results that make sense for a 23-year-old with chest pain for 2 days. And also we've added our sensitivity analysis, which allows us to cross between the symptoms with additional symptoms with vitals, tests, etc., to go and understand what are the important next steps potentially we need to do. So, and then we can see here our results, and in our results they're basically, the first part here is the histogram, which shows how our emergency levels of our particular results happen to be broken down. Here, this is the average score, which goes ahead and calculates, taking account of the probabilities and a lot of other information, what is the average level of acuity. So a chest pain for a 23-year-old is not necessarily immediately, an emergent issue, and we would have to ask additional questions. And then what we also have here is our genius list, which we'll describe in a little bit later, but that basically goes up in terms of the diagnoses we cannot miss, we really do need to think about because they are potentially life-threatening. So what let's do is go ahead and flip this for a 45-year-old. And obviously we're going to get a very different set of results. So now before we had asthma and GERD and hyperventilation being served for a 23-year-old, now suddenly we're getting much more interesting things such as angina and MI. So obviously for a 45-year-old that is actually much more relevant and much more disconcerting. And we can see here our average level has shifted from a 3.6 now to a 1.9, and definitely something where we potentially need to act very quickly. So let's also look at the genius list, and this list is going to go ahead and show us the types of diagnoses that we have to make sure we don't miss. So angina, MI were there, but now we also see PE, atrial fibrillation, and so on and so forth. So this is a way to very quickly analyze. So we jump back to our statistical list, and now we can go look at potential tests that make sense to be done, or stat tests, and potentially other tests. And so what we can simply do here is we can look and say, does he have any additional information? Is he, passing out? Is he dizzy? Is he increased sweating? Blue of the skin? Obviously, these are questions to be able to rule in or rule out potential emergencies. Or if we had done a test, such as an EKG, for example, we can first find out why that test may be done for. This is for the critical test. And we can see that in comparison to an EKG over here, which will show you the whole list of diseases which in this result set EKG is relevant for. But what we can simply do here is to go ahead and say we did an EKG and the EKG was normal. And let's see how that potentially can affect our results. So immediately what that did is took out many of our cardiac issues and brought it down and changed our emergency level from 1.9 to a 3.4. And we can see here many of those particular concerns were gone. And as well as we go in the genius list as well, we can see that we are no longer immediately dealing with cardiac issues, but rather some of the more pulmonary issues are coming into play. So this here is a very quick overview of clinical GPS. We can then end the interview, specify that perhaps you should be seen relatively soon, save that away, and then we're good to go. So this here was a quick overview of clinical GPS. There's obviously lots of additional things one can do, but this here should give you a flavor. We look forward to hearing from you, and any feedback or thoughts or suggestions are always very welcome. Thanks a lot. Cheers.